You're listening to Maximum Medicine Radio with host Doc Martin. Stay tuned in or call in. You won't want to miss what's happening next. How do you step into your maximum potential? How do you connect your spiritual drive with your physical path? Stick around as Doc Martin takes listeners on a journey through the seen and unseen, the accepted and the unbelievable. Get ready to meet the maximum you the world needs on Maximum Medicine Radio with Doc Martin now. A best-selling book, Lies I Taught in Medical School. And Rob, I'm going to be embarrassed to say I probably taught a few myself. So thank you so much for being here today. Welcome.
Oh, thanks, Sharon. I'm a fan of your program, so it's a real honor and a pleasure to join you today. I'm really looking forward to our conversation.
So you're walking the path of mainstream medicine. You're in that high push crunch world of science ruling what you do, but something must have happened to get you to step out of that and see things differently. Can you say what any trigger events were?
Yeah, absolutely. Yeah, there's a lot of people today are critical of Western medicine, but I'm coming at it a little differently. I'm actually part of the problem. I'm in teaching medical school. I do research like you mentioned. I write peer-reviewed scientific papers. My lab's got millions of dollars from drug companies and all sorts of different inputs like that, and I get to teach medical students and practice medicine, so it's great. And I was having a good time minding my own business when something happened that made me question what I was doing and question many of my tightly held beliefs that sadly many of my colleagues still have. And what that was I came down with 4 chronic diseases. And these are the chronic diseases that today most adults, Americans and worldwide really, have at least one of these chronic diseases, and many people have multiple ones. So the average, it's normal to be sick today in America, but I came down with 4 of those diseases. And I was basically, I went to my doctors, I was prescribed pharmaceuticals for them, prescription medicines. And I said to them, hey, what about lifestyle? Will that work? And they go, nah, not really. You're going to be on these drugs for the rest of your life, so get used to it. And, I realized at the time that, that wasn't going to end well, and something told me to, question it. So anyway, I began a deep dive looking at the research that's been done, and there's been a real breakthrough in these chronic diseases, including the 4 that I have, but really all of the ones that now occupy 80% of our healthcare dollars. And I was able to implement some changes literally in my lifestyle, relatively simple things. And after a period of time, I went back to see them, and the doctors, and they couldn't believe it. They thought the labs were broken. And it was basically, long story short, I got off all medications and basically reverse the diseases, or keep them in remission to the point I don't need anything. And now I've made it my mission to communicate this message to other people so that they can, take back their own health and learn from what I did, and hopefully not make the same mistakes that I made.
That's what I love, because I'm not against mainstream medicine. It works. But if a person can take responsibility and control of their own health, there are so many ways to heal outside of what mainstream medicine offers. And that's what my show is all about. But, I was thinking when you're talking about teaching, because I was on faculty at Emory, I taught physiology to first-year students, and I loved it. But the things that my eyes are open to now are so different from what we taught. But you did something that I think, in my clinical practice, and I work in a rural clinic, that people can't really do. Most people don't either feel empowered or have the urge or the momentum. They don't always take control, but you did. So what were the four horsemen?
Yeah, let me tell you those. But before I do, let me make a kind of a comment about Western medicine in general. I mean,
Mm-hmm.
the book is very critical of Western medicine, but don't get me wrong, I'm a huge fan of Western medicine, and I still am. And if you
Mm-hmm.
think about it, in the 20th century, kind of the modern medicine transformed the lives of all
Mm-hmm.
of us that were alive then, at least in that
Yeah.
century. And largely through public health measures, but the pills, the surgeries that were developed were nothing short of magical. They made the world truly a better place as far as health and disease. And even today, if I get hit by a car outside, I'm going to want Western medicine to
Mm-hmm.
give me that blood transfusion and maybe take out my spleen and fix my bones. And that's,
And you're
but
a radiologist. And so your imaging techniques in metabolic imaging that can identify a metabolically active nodule or mass so you know if it's cancer, that that is life-saving for people.
yeah, yeah.
So
And I
there are
think
things we don't want to throw away. I think you're absolutely right.
so Western medicine, it works. It's
Mhm.
the best we've had. We've never done anything better than that. But the problem is now in the 21st century, we're facing literally a tsunami of what are called chronic diseases. And they were present in the 20th century, but nowhere near in the numbers. Now they're in epidemic proportions never before seen in history, even accounting for population differences. And these chronic diseases, we all know them, but basically they run all the way from obesity to diabetes to hypertension, high blood pressure, cardiovascular disease, stroke, heart attack, cancer, Alzheimer's disease, and even mental illness. All of these diseases are taking up to 80% of our healthcare dollars by some estimates. And the problem is when Western medicine takes the same pills that, were so effective in the 20th century, the same surgeries, the same pills, the same approach, when it's applied to these chronic diseases, these treatments can be life-saving in the short term.
Mhm.
But they do control the symptoms. But what happens is, in many cases, the majority of cases, they don't control the underlying disease, and the underlying disease actually progresses and gets worse. And I believe, and what we talk about in the book, that these diseases, although they seem very different and very separate, are all based on one underlying abnormality, and that's metabolic dysfunction. And the metabolic dysfunction that drives Alzheimer's disease also drives cancer, also drives obesity and diabetes. It's sort of a root cause. So if we want to reverse those diseases, the pills and surgeries may help us with the symptoms in the short term, but just staying on the pills and surgery won't, in many cases, do anything for the long-term effects of the disease, and the disease will continue to get worse and worse. But there is something we can do that affects all these diseases at this root level, and that's lifestyle. And
Mhm.
relatively simple lifestyle things that we can do can actually slow down these diseases and reverse them. And it's the same lifestyle approach for Alzheimer's and cancer and diabetes and mental illness. It's the same metabolic approach for all of these that improves them. And that's the message I think that needs to get out.
Mhm.
It's, that people have a choice. I mean, I'm a doctor, right? I know, but even though I am a doctor, I know that doctors don't make me healthy. Doctors just make me less sick. And if I want to be healthy, I need to change my lifestyle, and that's something that I control, and it's going to be more powerful in most cases than any pills or surgery that I'm given or that most people are given during their lives. But it's about me. A doctor can't change my lifestyle for me. It's
Mhm.
something that I have to do for myself. And yeah, yeah.
So one of the
I've talked a
things
lot.
while you were mentioning the thing that I see is a real upswing in autoimmune diseases. So I'll tell you my metabolic story. About 18 months ago, February, almost 2 years ago, my hands hurt so badly. I couldn't bend them. I couldn't grip well. I just felt puffy. They felt like heavy mitts. And that went on for several months. I thought, well, I'm getting some arthritis. Okay, no big deal. Went on for several months. I said, I have got to find out what's going on. The physician assistant I work with ordered some basic blood work to check for rheumatoid arthritis, all the inflammation markers. Everything was normal. So I get an appointment with the rheumatologist, and he orders something that we didn't order, which apparently is a test that is like 98% certain if you have this, you're going to get rheumatoid arthritis. And it was high, double what it should be. And he said, you have rheumatoid, he pushed on places. I said, ow, ow. He said, you have rheumatoid arthritis. I said, no, I will not have rheumatoid arthritis. And then I found out from my aunt that she has rheumatoid arthritis. My grandfather had rheumatoid arthritis, and his father before him. So I'm like, no, I'm not going to have it. Well, I literally went home. I cut out all of the processed food in my diet, totally cut it out. Made sure I added more fresh fruits and vegetables, decreased the amount of meat, even though I haven't managed to be a vegan. I like meat. When I went back to him 6 weeks later, all of my symptoms were gone. And I said, because rheumatoid arthritis, for those who don't know, if your joints get damaged, that's permanent. You don't want the inflammation to damage your joints, especially not in your hands. And I said, if you tell me I have to take medicine, I will. And he said, no, you don't have to. You've done, wow. I have occasional stiffness in the wrist or bending my hand, every couple of months. But I decided, just as sounds like you decided. And I said, and this is the other thing, and we could talk a little bit about this, the intentionality that you hold. If you really want to be empowered about your health, you have to be completely coherent, cohesive in your thinking, your action. And I said, no, I will not have rheumatoid arthritis. But I did the hard stuff. I got rid of dairy, and which is supposed to be an immune trigger. I got rid of cheese. I like cheese. So I made some sacrifices, but my hands don't hurt.
Yeah, no, that's a great, congratulations on doing that. And that's so good. Rheumatoid arthritis is a type of inflammatory arthritis. It's just like one of the diseases I had was another type of arthritis called gout, which is an inflammatory arthritis. And, people report with other things like psoriasis and other inflammatory skin conditions when they change their lifestyle, not everyone, but many people can reverse these diseases just like you did. And I love what you're saying about taking agency and taking control of your life, because that's the message, I think, for the future is, I used to, as a patient, I would, I go to my doctors and they tell me things, and then, they would diagnose the disease, whatever. But now I realize that in writing this book, another thing I realized was that these diseases, especially these chronic diseases, again, that I'm talking about, the big ones, and they're not only big for chronic diseases, these are the diseases also statistically that you and I and most of the people listening to this will die of. Those are the causes of death for people that they die of eventually. And just like Jim Morrison says, nobody gets out alive. So we have to die of, something at some point. But the point is to push them back as late as we can. And with lifestyle, I believe it's possible to do that, you know, and not have the disease when you're 60 or not have it when you're 80, but, you know,
Hmm.
maybe have it when you're 105 or something, you know,
Ooh, that'd
and,
be
and,
good.
and
Hmm.
doing it that way. And, but the other thing I realized was that I used to think that, and a lot of people still think this way, my colleagues too, that you have type 2 diabetes when you walk into the doctor's office and she or he says, "Oh, you know what? Your glucose is too high. You have type 2 diabetes," you know, or you have Alzheimer's disease when the doctor says, "Oh, you forgot your keys, you know, that's, you know, and we test you've got
Hmm. Hmm.
Alzheimer's," or, you know, "Oh, you've got, you know, hypertension." Well, what I believe now, and there's the very strong evidence to support this, is that these diseases, they don't really start just when the doctor tells me I have them, but these chronic diseases, they begin years to decades before the doctor makes the diagnosis. And it's not that the doctor's doing a bad job and they're missing it. It's just that, you know, the doctor you have to have a certain point where things begin. And so they just pick an arbitrary point. But the thing to realize is these diseases are going on in all of us, and to varying degrees. I mean, not everybody gets Alzheimer's, not everybody gets
Hmm.
cancer,
Hmm.
not everybody gets a heart attack, but pretty much, you know, one of those three, or, you know, including the other ones I mentioned as well. So the point is, rather than if we wait for the doctor to make the diagnosis, I believe we're missing a huge opportunity for prevention. And that prevention is accomplished, like you say, with a mindset, with the intention that I am going to be in charge of my life. I am going to take
Hmm.
over my lifestyle. It's my decision. It's my agency. And the beautiful thing about lifestyle is I get to decide every morning when I wake up when I'm going to eat, what I'm going to eat, when I exercise, when I sleep, what what my mindset is. Is the world a loving, beautiful, grateful place, or is it a scary place full of dangers and traumas that are going to hurt me? You know, and all, not that we can choose completely our reality, but the lens and the interpretations of events in our lives become the lens through which we see the present and the future. And it's sometimes possible to change that lens through, you know, all sorts of techniques. But I love the work you're doing, and it's so powerful.
Thank you. And I want to just talk about that just a second. That lens is really important today with the fractured things that are going on in society, with the stress everybody was under for the election, and how half of the country is them versus the other half, which is us. That lens can help us if we can shift to being kind, to being grateful for whatever, be all of that to help us stay in unity so we don't split apart. That's for me, that's really important in the social environment we're in these days, not just for our health, but for making it through.
Yeah, and
Just
I love the quote or the expression that the stress in our lives is not created by the experience we have, but the stress is defined by the meaning that we associate with the experiences we've had. In other words,
Mhm.
the same experience may be very painful. It's a surgical operation. It's, you know, my chest is cracked open and, you know, it's a painful thing. It's traumatic. I go through it. Yet someone else may have literally the same experience, like, let's say, a woman with a cesarean section for childbirth. And it's a joyous experience because it's about
Mhm.
new life and things. And so it's such a powerful technique. I just did a program, and he was on my podcast. A guy named Joe Dispenza, who
Mhm.
does a lot of work about intention and visualizing the future, and I know your work is along you know, there are similarities there, and I really believe that's true, that we can we can certainly influence our present, what we see, the way we see the world,
Mhm.
but I believe that we also influence the future by our mindset and the way we see reality.
I do too. That we should have a whole other episode just on that because I love that stuff. But let's go to talking about your book because well it had a very grab you title, the lies I taught in medical school. So let's break those down a little to show people how to think differently about some of these chronic illnesses. Take
Yeah.
one of the myths, take one
Well,
of the lies.
let me before I do that, let me
Okay.
frame it a little bit in
Okay.
it is a provocative, some would say clickbait sort of title. It gets people's attention. Lies I taught in medical school. Did I intentionally teach lies? No, I didn't. And my heart of heart, I don't believe that most physicians or anybody gets up wanting to harm people.
Hmm.
But there are conscious, unconscious, pernicious financial and other incentives that the machine we're in helps puts people in a situation where they do things that can harm people, and that's what that's about. But the title specifically, it kind of references one of the greatest physicians of all time named Sir William Osler, and he lived at the
Hmm.
end of the 1900s, and he has one of the most famous quotes about medical education that this book, this sort of title, is based on. But he famously said to a class of graduating medical students on their last day of medical school, before they became doctors, and they were probably all men, because when he addressed them, he said, "Gentlemen, you know,
Hmm.
I have a confession to make. 50% of what we just taught you is incorrect. It's dead wrong. The problem is, and furthermore, we don't know which half it is." And anybody who understands science and certainly medicine, that's very, very true. That's the nature of reality. It's the truth today is just our best guess approximation. So the point is that think our knowledge is constantly evolving, and the problem is, doctors, they go to medical school, they learn a lot of stuff, then they super specialize, and they get in a very narrow area, and it's hard enough just to keep up with your specialty. But everything else is changing all around you, and it's challenging for all of us, doctors and patients, to keep up with these truly dramatic revolutionary changes that have just happened in the last 5 and 10 years. And that's
Hmm.
that's that's what the title's about, really.
I think the other thing is I have many patients who are frustrated because, and maybe we as physicians and healthcare providers have believed it ourselves, that things are black or white, and that this test means you have this or you don't. And as you come out of medical school, and then you start to learn that really this is a world of incredible varying shades of gray. But patients get frustrated because they want black or white. And they think, and of course, I could argue that doctors, love to um, inculcate that belief in patients is that doctors had, the answers, but it's so gray and there is so much. And now you're right. I mean, now I use every day an AI thing to look up stuff. I can't keep up. I have a pretty good brain, but I can't keep up. So yeah, it's
Yeah,
totally swirling all
absolutely.
around us.
Yeah, even I mean, another sort of wake up call for me is, as I was saying, as physicians, we're taught that the patient either has a disease or they don't. And if you take
Mhm.
arguably one of the single most important chronic disease right now is type 2 diabetes, which is linked with all the other diseases I mentioned. If you have
Mhm.
type 2
Mhm.
diabetes, your risk of Alzheimer's is huge. It's type 3 diabetes, your risk of cancer, your risk of, it goes all of those diseases. So type 2 diabetes is it's a basic metabolic abnormality, insulin resistance, that drives all the others with inflammation and all those other things. And I used to think that, well, some people get type 2 diabetes and some people don't. God bless them if they don't. If they do, help them any way we can. But then some interesting research came out. There's a blood marker that's used to diagnose type 2 diabetes. It's related to blood glucose, but it's called hemoglobin A1C. That when it crosses a certain line, then you have type 2 diabetes. And when it's below that line, you don't. You may have prediabetes, but you'll be normal. And somebody did an interesting study with a large population of patients from the Framingham data and the NHANES data. So it was a lot of people, and they looked at adults who were not diabetic, so non-diabetic adults, and they looked at this marker, hemoglobin A1C, over time as they got older and older. And this marker just kept going higher and higher and higher like that. It just kept going up and up and up with age. Well, what does that mean? Well, it sort of changed my thinking about diabetes. This inflammation, this insulin resistance, that it's the root cause of all these chronic diseases. This type 2 diabetes is, I think now it's kind of like gray hair. In other words, if I live long enough and I don't die of something else, I'm going to get type 2 diabetes. We're on the path to it. In other words, most of us, maybe not everybody, but the majority of people. And so what does that mean? Well, it means that I and all of us need to pick a metabolically healthy lifestyle now, even if we're not type 2 diabetic. It's not like, hey, I'm not a diabetic, I don't need to watch my sugar. Well, you know what? Yes, you do. Because you're driving all these other things. And so it's fascinating how how things are evolving like that.
Yeah, I love that. So talk about some of the myths and what your eyes have opened to.
Yeah, well, I mean, since since we're talking about diabetes, and diabetes is a huge problem. The diabetes we're talking about is called type 2 diabetes, but it's 90% of the diabetes that we see today. It used to be called adult onset diabetes, but of course, all these diseases now are occurring in children. So we can't use that anymore. All these chronic diseases are occurring younger and younger as part of this tsunami of diseases. But type 2 diabetes is it's interesting. There are two ways to treat it, really. The American Diabetic Association, which is the mouthpiece for the scientific institutions about diabetes, recommends that you treat diabetes with type 2 diabetes with certain drugs, things like metformin, sulfonylureas, and then eventually insulin to control the high blood sugars that are part of type 2 diabetes. And when people do that, don't get me wrong, the insulin is life-saving in a short term. It'll keep you from dying of hyperglycemia and that sort of thing. But the interesting thing happens when you manage diabetes this way, like the American Diabetic Association says, with these pills and injections, diabetes becomes a chronic progressive disease. In other words, it goes on to all these other things. What's the number one cause of surgical amputations today? Is type 2 diabetes. People get their toes and feet chopped off because of the vascular disease. What's the number one cause of kidney failure and dialysis? Is type 2 diabetes. What's the number one cause of retinal blindness in young people? Is type 2 diabetes, and on and on and on. All the diseases we talked about. So when you follow the American Diabetic Association's recommendations with the pills, your disease is the symptoms are controlled, but it's a chronic progressive disease and it keeps getting worse and worse and worse and worse. Okay, well, if that's the best we have, that's what it is. The problem is it's not the best we have. Before the pills and surgeries and insulin and metformin were discovered, people used to treat diabetes with diet. And it was very effective because in a lot of ways, diabetes is a problem with carbohydrate metabolism. You probably talk with your audience of the three macronutrients, you know, fat and protein, which are essential for life. If we don't eat those, we'll die. The third one is carbohydrates, which is sugar, glucose, starches, rice, flour. Interestingly, these are not required. You don't require, and there's some human populations that eat very little carbs and they do just fine. Also, interestingly, the carbohydrates are what drive the insulin that basically fuels the insulin resistance. So when the other way to approach type 2 diabetes is just to cut out the carbohydrates. In other words, sometimes people go on a carnivore diet, or you can do it on a vegan diet too, but just to lower the carbohydrates. And there are now controlled studies from Virta Health and other organizations that were, you know, prospective studies that showed that, you know, over half patients with type 2 diabetes could reverse their diabetes and get off the pills and medications just with diet. But something else happens. When you do it with diet, the majority of these patients no longer, you've arrested the disease. In other words, it doesn't progress to renal failure. It doesn't progress to ulcers and amputation and heart attack and all these other things. And why on earth would the American Diabetic Association not, you know, emphasize that? Well, if you look at their website, they have recipes on it, and the recipes have, some of them have a large amount of sugar in the recipes, which, you know, is a carbohydrate. And their recommendation is just to, quote, cover it with insulin, which protects you in some extent from the high sugar, but it basically doesn't control the progressive disease. Well, who are some of their biggest sponsors? On that recipe, there was an ad from their sponsor, was DaVita Corporation. DaVita Corporation is the leading maker of, essentially, in the dialysis business for renal failure. What's the number one cause of renal failure? It's people who eat, you know, carbohydrates in their diet, like the American Dietetic Association says, and cover it with insulin. You know, so.
Well, you know, for years, and I'm going to say 20 years, you're probably familiar with Dr. Joel Fuhrman's work. He's family practice doc out of New Jersey who said to his patients early on, change your diet. And he has numerous case studies. And then he wrote best-selling books, Eat to Live, Eat to Get Rid of Diabetes. And, you know, you can, it's amazing how you, if you change your diet, you can stop this disease in its tracks.
Yeah.
But something, Rob, tell me what you've learned in your studies and awarenesses of this. Something happened in our foods because people are hooked on the American diet. And it's very hard, not just financially, because it's financially difficult for some to eat fresh fruits and vegetables. It's not as cheap as processed food. But something happened to, we got hooked on junk.
Yeah, and you can look on the timeline. You know, I'm old enough to remember the 80s and 90s,
Uh-huh.
and you can see in the 80s and 90s, obesity took off, diabetes took off, all these chronic diseases took off, and that's when you can trace them to their beginnings. Well, what happened then? I mean, there are many things that happened, but here are some of the likely culprits. The tobacco industry was facing headwinds from regulation on tobacco, but tobacco industry, they were experts on selling people stuff. They put cigarettes in 7-Elevens. They advertised them. They wanted to advertise to children, but that, you know, they made that illegal, so they couldn't do that. But they, you know, they were masters of marketing and selling. Well, in the 1980s, the tobacco industry pivoted and purchased several large junk food makers, and they essentially moved into the junk food business. What does that mean? Well, they took their brilliance of advertising, and instead of advertising cigarettes now, they could sell junk foods. And if you think about it, look at the 7-Elevens, look at the gas stations, look at these places, these brightly colored foods that are now Plus, the guardrails were gone. They could now advertise these to children because there are no laws against selling children junk food. So now you have cartoon characters in brightly colored boxes telling you to eat sugar cereals, and that's okay. And so that's one thing that happened. Second thing that happened in the 1980s, cane sugar was used as the main sugar source, and it was replaced by the discovery of high
Mm.
fructose corn syrup, which
Yeah.
is chemically it's similar. It's basically glucose and fructose, but it's produced from corn. And as you hinted at, I think one reason junk food is inexpensive is because it's supported by tax dollars. In other words, the junk food industry is subsidized by taxes through the farm bill. To grow corn is subsidized, soybeans are subsidized, and a few others. And these are the largest, high fructose corn syrup comes from corn, and now it's cheaper than cane sugar, and it has better shelf life and other factors. But long story short, in that time period, basically Coca-Cola, Pepsi-Cola, and every junk food maker around the world substituted high fructose corn syrup for other sources of sugar at the time. And it went everywhere. Then
You
something,
know,
yeah,
I live rurally where I see, cornfields everywhere. And what I don't think people realize is even when you buy from the farm stand as you drive past it on the road, and in the summertime, and you buy a dozen ears of corn and you get, Silver Queen or sweet pea or whatever, those things are genetically modified to be high sugar producing corn just in and of itself. And I try to explain to my patients, what did we fatten up cows and pigs with? It's this kind of genetically modified high sugar corn. So when you go to pick your vegetable, please don't pick corn.
yeah,
Don't pick corn. Pick, pick broccoli or cauliflower or something. But yeah,
yeah.
it's
And even
true.
the fruit, people say, hey, fruit's healthy. People have been eating it for thousands of years. Don't tell me not to eat fruit. Well, no, people have not been eating the fruit we have for thousands of years. The fruit we have is engineered
Mhm.
various ways, genetically and otherwise, to be very high sugar content. Our ancestors wouldn't recognize the apples and bananas and things that
Mhm.
we have because it's different, and they're micronutrient poor, just like our vegetables are, and just like our meat is also, for all sorts of reasons. But one one other thing happened in the 1980s that was really interesting is that in the 1980s, fried foods were fried pretty much around the world in healthy beef tallow and other types of saturated fat, which is stable at high temperature, and that's the way it was just done for hundreds of years. In the 1990s, through sort of a misguided effort for the Center for Science in the Public Interest, and a billionaire funded them, they believe that saturated fat caused heart disease, and that's a whole nother conversation. But um, I think there are worse things causing heart disease like sugar and other things. But anyway, because of that belief about saturated fat and heart disease, they they convinced McDonald's and Burger King and essentially everyone else all over the world followed suit, and they removed beef tallow from fryers all over the world. And what did they substitute it with? Well, that corn, right? Corn is cheap. It's subsidized. So they took corn oil called canola oil or soybean oil, or it's a group of oils called seed oils or vegetable oils, which are very unhealthy because they're pro-oxidative, they're pro-inflammatory. They also happen to be unstable at high temperatures. So when you put them in a fryer, they break down into toxic things. But fried foods all over the world now are made with this because it's a lot cheaper to put in vegetable oil than beef tallow. So it's a cheaper substitution. So these seed oils came on the scene, and a few other things happened then too. Maybe it was
Yeah,
punk
things
rock or something,
just,
but yeah.
we're kind of in a challenge. And even if you do purchase raw fruits and vegetables, the quality of our soil is being diminished. That's a whole other conversation. The pesticides we use, the fertilizers we use. Yeah, anyway. But we only have a few minutes left. So I want to have you tell our listeners, if you were going to start, as you did, on your journey to shift the trajectory of those 4 horsemen, what would you tell people to do? What are some of the major things they should think about doing?
Well, I started off with nutrition, partially because my mom was a dietitian, so I was raised in the idea that, food mattered. And also I realized that food is the one medicine that most of us take every single day on earth. So I started with nutrition, and basically my mom, the dietitian, had told me to eat many small meals throughout the day. That was the healthy way to eat. And now I realize, and we talk in the book, why not doing that is much healthier. And even so-called intermittent fasting is, decreases inflammation, and it's very healthy. So the first thing I did was just cut out snacks, and then eventually, cut out breakfast and sometimes lunch even. And so without even changing what I ate, changing when I ate was a huge thing. And then I just went from there.
And what other suggestions would you have for our listeners for them to start to take control of their health and make sure that they are not simmering these chronic illnesses?
Yeah, part of it is just being aware of these things. That's the first part, just so that you become conscious and you think about things. Because I wasn't aware of, seed oils or these other things and how harmful they were. And while I think nutrition is fundamental, I want to be clear that even if I have a perfect diet and perfect nutrition, if my sleep is messed up, or if my stress is messed up, or if my exercise is out of whack, that can drive my metabolic disease, even in the face of almost a perfect diet. So there are really 4 pillars of things people have to look at, but I think being aware of it first, just to go, wow, I didn't know that mattered, like for sleep. I mean, I'm a doctor. I used to be on call all the time. I carry a beeper around. I thought it was helping my patients. I thought I was being tough because, I was on call 24/7. Now I realized I was actually being stupid, and I was hurting my patients potentially because, sleep, not getting not only quantity of sleep, but quality of sleep is very important. And it affects our judgment. It affects us on a very metabolic level. All of the chronic diseases that we're talking about can be driven and made worse by sleep disorders in the absence of every other lifestyle thing.
And one thing that I think is important, and then we'll close after this, is what I have a hard time convincing patients, even if they're sick with a cold or something, stop and rest. We are so go, 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 and we're so believing that doing is the only way to be valuable, when sometimes that your body needs that regeneration. If you're sick, take the day off, rest, sleep in, take a nap. We need to be kinder to ourselves, I think.
Yeah, kindness to ourselves is
Yeah.
really important. I need to keep
Well,
reminding myself
everybody,
that too.
we're closing up. This is Dr. Robert Lufkin, who wrote Lies I Taught in Medical School. Check it out, because your eyes will probably be opened, and maybe it'll help you make some good choices for going forward and preventing chronic illness. Rob, thank you so much for joining me tonight.
Oh, thanks so much, Sharon. If people want to, they can download a free chapter on my website too, if they want to check out the book before
And
they go
tell
to the
us what
library.
your website is, please.
Oh, it's robertlufkinmd.com.
Perfect. All right, everybody. Thank you for being here. That was a wonderful thing to really get us thinking about how to take charge of our health. Rob, thanks for being here.
Thank you, Sharon. It was
All
just a
right.
lot of fun.
Okay. Bye.
Bye.